The effects of coffee on health have been a topic of considerable debate over the years, with numerous studies examining its potential benefits and risks. Here's a detailed exploration of the potential effects of coffee on health, considering various aspects. Potential health benefits of coffee. Antioxidant properties. Coffee is a rich source of antioxidants such as chlorogenic acid and caffeic acid, which help neutralize harmful free radicals in the body, reducing oxidative stress and inflammation. These antioxidants may contribute to the protective effects of coffee against certain chronic diseases. Improved cognitive function. The caffeine in coffee acts as a central nervous system stimulant, increasing alertness, attention, and cognitive function. Moderate coffee consumption has been associated with improved cognitive performance, including enhanced memory, concentration, and reaction time. Reduced risk of neurological disorders. Some research suggests that regular coffee consumption may lower the risk of neurodegenerative diseases like Alzheimer's and Parkinson's. The antioxidants and caffeine in coffee have neuroprotective effects, potentially slowing the progression of these disorders and reducing the risk of developing them. Enhanced physical performance. Caffeine in coffee can enhance physical performance by stimulating the nervous system, increasing adrenaline levels, and mobilizing fatty acids from fat tissues. Athletes often use coffee as a pre-workout supplement to improve endurance, strength, and exercise performance. Lower risk of certain diseases. Several studies have found associations between moderate coffee consumption and a reduced risk of certain diseases, including type 2 diabetes, liver diseases, such as liver cirrhosis and non-alcoholic fatty liver disease, and certain types of cancer, such as liver and colorectal cancer. The exact mechanisms underlying these associations are not fully understood, but may involve the effects of coffee on insulin sensitivity, liver function, and inflammation. Heart health. While early research suggested that coffee consumption might increase the risk of heart disease due to its acute effects on blood pressure and cholesterol levels, more recent studies have found that moderate coffee consumption is not associated with an increased risk of cardiovascular events. In fact, some research suggests that moderate coffee intake may be associated with a reduced risk of heart failure and stroke. Mood enhancement. Coffee consumption has been linked to improved mood and a reduced risk of depression. Caffeine acts as a mild antidepressant by increasing the production of neurotransmitters like serotonin, dopamine, and noradrenaline, which regulate mood and emotions. Potential risks and considerations. Caffeine dependence and withdrawal. Regular consumption of coffee can lead to caffeine dependence, characterized by symptoms like headache, fatigue, irritability, and difficulty concentrating when caffeine intake is reduced or discontinued. Withdrawal symptoms typically resolve within a few days, but can be unpleasant for some individuals. Insomnia and sleep disturbances. Consuming coffee, especially in the afternoon or evening, can disrupt sleep patterns and contribute to insomnia or poor sleep quality. Caffeine's stimulant effects can interfere with the onset of sleep and reduce total sleep time, leading to daytime fatigue and impaired cognitive function. Gastrointestinal issues. Some individuals may experience gastrointestinal discomfort, such as acid reflux, heartburn, or diarrhea, after consuming coffee, particularly if they have underlying gastrointestinal conditions like gastroesophageal reflux disease, GERD, or irritable bowel syndrome, IBS. Increased heart rate and blood pressure. The acute effects of caffeine can temporarily raise heart rate and blood pressure, especially in individuals who are sensitive to caffeine or consume large amounts. While these effects are usually mild and transient, excessive caffeine intake may pose risks for individuals with pre-existing cardiovascular conditions. Pregnancy and fertility. High caffeine intake during pregnancy has been associated with an increased risk of adverse pregnancy outcomes, including miscarriage, preterm birth, and low birth weight. Pregnant individuals are generally advised to limit caffeine intake to moderate levels, for example, less than 200 to 300 milligrams per day. Similarly, excessive caffeine intake may impair fertility in both men and women. Potential interactions with medications. Coffee and caffeine can interact with certain medications, affecting their absorption, metabolism, or effectiveness. Individuals taking medications should consult with their healthcare provider to determine whether caffeine consumption needs to be adjusted to avoid adverse interactions. Individual variability. The effects of coffee can vary widely among individuals based on factors such as genetics, tolerance to caffeine, overall health status, and lifestyle habits. While some people may experience significant benefits from moderate coffee consumption, others may be more sensitive to its adverse effects. In conclusion, coffee can be a part of a healthy lifestyle for many individuals when consumed in moderation. Enjoying coffee in reasonable amounts is unlikely to cause harm and may even offer several potential health benefits. However, it's essential to be mindful of individual tolerance, avoid excessive consumption, and consider potential risks, particularly for vulnerable populations such as pregnant individuals or those with certain medical conditions. As with any dietary choice, moderation and balance are key to maximizing the potential benefits of coffee while minimizing any associated risks.